Hi everyone, my name is Shuni. I'm a semester 3 nursing student.
Hi, I'm Kara. I'm also a semester 3 nursing student.
Today we are learning how to manage high blood pressure during pregnancy. So we know it is very important to manage your blood pressure during pregnancy because high blood pressure can affect both your health and your baby's health. So before we start, let me give a definition of high blood pressure. High blood pressure, also called hypertension, means that the force of the blood pushing against your artery walls is consistently higher than normal. When the pressure stays on high, the heart has to work harder, and then this can lead to problems during pregnancy. And there's are two main types of hypertension we can see in pregnancy. The first one is called chronic hypertension, which means you already had high blood pressure before pregnancy, or we found out before 20 weeks of the pregnancy. Since it's a long term, we usually monitor it closely throughout the pregnancy. The second type is called gestational hypertension. This type of high blood pressure appears after 20 weeks of pregnancy. It does not include protein in the urine. Many women with gestational hypertension feels completely normal, so regular prenatal checkups are very important to catch it earlier. Both hypertension can lead to another serious condition which is called preeclampsia. It happens when pregnant women develops a high blood pressure after 20 weeks and found the protein in the urine. This means the kidney are being affected and it can progress quickly. Preeclampsia can also cause problems with your liver, brain, and your placenta. Without treatment, it may lead to seizures, stroke, or early delivery. High blood pressure during pregnancy increases the risk for a lot of placenta problems, seizures, stroke, and even preterm birth. But the good part is we are here to help you, and with any early detection, good monitoring, and proper treatment, a lot of complication can be prevented.
Okay, so now we're going to be talking about some warning signs to look out for, and then it's like signs that our body gives us that our blood pressure is getting worse and that we could be progressing. So some signs to look out for is if your blood pressure reading is 140/90, if you have a severe headache that doesn't go away with rest or medication, blurred vision, seeing flashlights or seeing spots, sudden swelling in your hands, feet, or face, especially if it comes on quickly. Pain on the upper right side of your abdomen, which is right under your ribs, shortness of breath, or difficulty breathing. So all of these signs are symptoms that your blood pressure is dangerously high or that preeclampsia is developing. Make sure that if you have any of these symptoms, you're reporting them to your providers to make sure that you're safe and your baby is safe.
Now we're going to talk about some management. So after you call your healthcare provider, he or she might prescribe you some medication that considered safe during pregnancy. This includes labetalol, nifedipine, and hydralazine. This medication can help you lower your blood pressure to a safe range. It is very important for you to not stop taking your medication suddenly. Even if sometimes you feel you're getting better, stop medication abruptly can cause your blood pressure to rise even higher or even more quicker. You will also need to check your blood pressure at home daily. This helps us to see what your blood pressure looks like outside of the clinic and allows us to catch up any dangerous changes early. And also make sure to attending all your prenatal visits. It's very essential because your provider will monitor your baby's growth, check your urine for protein, and make sure your blood pressure is staying in the safe range. Besides medication, lifestyle changes helps a lot too. Try to reduce stress by resting often, take breaks during the day, and then practice deep breathing and meditation.
Okay, so now we're going to talk about how to check your blood pressure at home. So an accurate reading will help you and your provider to understand what's happening to your body. So first, we're gonna you or your husband can do this. So you're gonna sit down quietly before measuring, and it's for 5 minutes. And it's important that you don't check your blood pressure right after walking or going up the stairs or feeling stressed, because it can create a false reading of a high blood pressure. And with your back supported, feet flat on the floor, and legs not crossed. Rest your arm like near your heart level, and then we're gonna place the cuff on your bare upper arm, not over clothing. So we don't want this. We would normally do it without it. And then you're gonna wrap the cuff around your arm and press the button to get your blood pressure taken. And make sure to take 2 readings 1 minute apart. Write down both readings and include the time of the day. Thank you. And then some safety numbers to keep in mind and when to call your provider is if your blood pressure is 140/90 or higher, you want to call the doctor. And then if your blood pressure is 160/110 or higher, you want to go to the emergency room as soon as possible, even if you feel normal. And many women with high blood pressure feel fine even with these numbers, but it's important that you take action quickly.
Now I will continue to have some healthy lifestyle tips prepared for you. So the first thing we want to make sure is you eat a healthy diet every day, which is well balanced and with a low in salt. Because salt can make sure your body hold onto extra fluid, and which can increase the blood pressure. And also we want you to eat more fruit, vegetables, and more like the lean proteins such as chicken, fish, tofu, and beans. Second, we want to make sure that you drink plenty of water throughout the day. So you have to drink a lot of water, avoid smoking, avoid alcohol or any other like drugs, because they can also raise the blood pressure and harm your baby. And the third is good sleep is also very important. We want to make sure you aim for 7 to 9 hours sleep each night. Even though sleep sometimes can be difficult, try to sleep on your left side during the pregnancy pillow, or adjusting the room temperature, so make sure you can sleep comfortably. And also emotional support is really, really important. Sometimes pregnancy can be really, really stressful, especially with a health condition. So we want to make sure you have family support, prayer, meditation, and talks with someone can help you relieve your stress. A calmer mind helps support a healthy body.
Okay, so these are some warning signs of when to go to the hospital, so emergency signs. So if you're having a seizure or you're fainting, you have severe chest pain, fast or irregular heartbeat, your baby is moving less than usual. These symptoms require urgent medical care. Do not wait at home and go to the emergency room or call 911 if needed.
So now we prepare a scenario to help you better to see how to prevent high blood pressure situation at home and clinic. So I'll be the patient Maria, and Carol will be the partner and the nurse.
Yes.
I don't know why I'm having this headache. It's just so bad. Maybe I should take a Tylenol. But it's still. Alex,
Alina, are you okay? What's
no,
wrong?
I don't know why my head is like breaking right now.
Oh no.
It's hurting so bad, and I don't know. I just got these glasses, but it seems like it's not helpful. Like I still can't see it clear.
Did you get good sleep yesterday?
I think so. Like, and I took Tylenol, so it should be fine. I don't know why my head's just like so heavy and so painful.
Oh, okay. I think I remember the nurse saying something about like these signs or like checking your blood pressure. Do you want to check your blood pressure?
Okay. Maybe.
Yeah. Do you know where the blood pressure cuff is?
I think it's over like the
Okay,
corner
okay.
there. Like, just take it.
Do you remember how to use this?
Should I like put it here? I think.
Here?
But I need to remove my sleeve. I think.
Oh, okay.
Yeah.
Let me help you pull that up.
Mhm.
Okay. Let me wrap it. So I just wrap it.
Yeah, like
Okay.
this. Oh, and like I can't cross my leg.
Okay,
Yeah.
okay. Let's
Yeah,
make sure
I
you're
think it's
sitting
good.
still. You
Yeah.
didn't have any intense or like any activity before this, right?
I was
Okay.
just like resting.
Okay,
Yeah.
that's good. Let me wrap this around you. Let me press the button. Okay, it looks like your blood pressure It says 150 over 94. Do you know what that means?
Is that high?
I'm not sure. Let's go
maybe
to the
we
clinic.
should, we should call. Maybe can you call the nurse and ask if the numbers are normal?
Yes. Let me give a call really quick.
Okay.
Hi, Nurse John. How are you? My wife Maria, she is 28 weeks pregnant and she keeps having a headache, severe headache, and it's not going away with Tylenol. And she's having some vision problems and her blood pressure reading was 150 over 94. We were just wondering if this is normal. Oh, okay, it could be warning signs of preeclampsia. Okay, we'll head over to the clinic right now. Thank you. See you soon. She said to go to the clinic.
Okay,
Let's head over to the
we should
clinic.
go.
Yeah.
Hi, nurse.
Hi, Maria. What's wrong? Are you okay?
I don't know. I'm just not feeling well today.
Okay.
Yeah.
How are you not feeling well?
So like, I was waking up from a nap and I feel like my head is so heavy and like it's so painful, and I thought it's just like normal because of like the stress. So I took a Tylenol, but it doesn't help at all. And I don't know if I also should mention that, but like my new glasses probably not working well. Like
Okay.
my vision is still so blurry, but I don't know if that's from the new glasses or from my own eyes. And also like the blood pressure is like a little bit high, so my husband called earlier.
Okay.
And he can also like check my tummy. I just like feel like my stomach is hurting too.
Yeah. Let me check your blood pressure before we start. Okay. So it says your blood pressure is 156 over 100, which is higher.
Is it high?
That is higher than what we'd
see.
want, but we're gonna get the doctor for you and we're gonna get the right treatment for you. And then, do you have any pain right here?
Oh, it's actually hurting.
Okay. So these could be warning signs for something called preeclampsia, but we're gonna get you the right treatment.
What is preeclampsia?
Preeclampsia is like it can progress from hypertension, because I know you got diagnosed with gestational hypertension.
Yeah, I do.
But it can progress to that, but we're gonna try to prevent it and make sure that doesn't progress there.
Am I gonna be okay?
You're gonna be okay.
Okay.
Yes, we're gonna do everything we can to protect
Thank you.
and make sure you and your baby are safe.
Thank you so much.
Yeah.
So it's all normal, right? Like my eyes and like my ribs, is like fine?
It's not normal things we would want to see, but we're going to make sure to get you to a safer and healthier range.
Okay. Yeah. I think I will just wait for the
Yeah.
doctor
Just
to
wait
come.
here and let me call the doctor for you.
Thank you.
Yeah. Thanks for coming in.
Thank you.
Yeah.
So managing high blood pressure during pregnancy can be really overwhelming, but you are not alone. With regular monitoring, health habits, and good communication with your healthcare team, you can protect your health and your baby's health. If you ever have any question or feel unsure, always reach out to your provider. Thank you for learning with us today.